Honorable Deputy Chief Minister and the Minister for Health and Family Welfare, Government of Uttar Pradesh, Shri Brajesh Pathak ji, Padam Shri Dr. C.N. Manjunath, was a Member of Parliament, also an eminent cardiologist, and the past President and permanent invitee of the Indian College of Cardiology, the founder President of this society, respected Hemant Sharma ji, who's a very senior journalist, very learned man, and currently serving as director of the India TV9 network. Dr. N.N. Khanna, organizing secretary of ICC, Dr. S.N. Rautre, president ICC, Dr. K.H. Srinivas, president-elect and chairman scientific committee of the ICC, Dr. C.M. Nagesh, honorary secretary, Dr. Rajiv Kumar Rajput, Dr. B.H. Natesh, and all the respected dignitaries, esteemed members of the medical fraternity, all the distinguished participants, scientists, researchers, friends from the media, and my MLA, Dr. Sunil Patel is here, my party workers from Apna Dal, everybody who's part of this esteemed gathering, a very good evening, namaskar. It gives me immense pride to join you all for the 32nd National Conference of the Indian College of Cardiology in the timeless city of Kashi. Few minutes back, we heard respected Hemant Sharma ji, and he gave us many mythological references and traced the origins of medical science to this holy city of Kashi, and is the best person to talk on those issues. However, I have a different reason why the selection of Kashi for hosting this very prestigious forum becomes very significant. Just 2 days back, on 17th of September, Varanasi witnessed grand celebrations on the occasion of Honorable Prime Minister of India, Shri Narendra Modi ji's birthday. So this is the place which has given us our Prime Minister, which is what makes it very, very special. And Prime Minister Narendra Modi ji is not just a popular leader in India. He is a global leader today. And we say this because you've also seen how one nation after the other is bestowing their highest civilian honor on India's Prime Minister. Narendra Modi ji is the Member of Parliament from Varanasi for the 3rd time, a true global leader who has transformed the image of Kashi from being just a symbol of antiquity to a model of progress today. So I'm very happy, I'm very glad, and I thank the organizing committee for selecting Kashi to hold this very prestigious forum. And I extend my warmest greetings to Dr. N.N. Khanna ji, who is himself an internationally acclaimed cardiologist, and his entire team for bringing this very esteemed gathering, very illustrious gathering of interventional cardiologists, cardiac surgeons, vascular specialists, researchers, physicians, everybody here, to my own home state of Uttar Pradesh, which has the potential to become the hub of advanced cardiac care and innovation. My dear friends, cardiovascular diseases have become one of the greatest health challenges of our time. And it is not just the story of India, but the story of the world. That they are contributing significantly to mortalities and morbidities and affecting millions of families. But what's important is to understand that we have the power to change the story. And when I represent Government of India here today, I wish to say that as policy makers, we do realize the importance of investing in prevention, early detection, timely treatment, innovative solutions for treatment and expansion of healthcare. And we are doing everything to ensure the best healthcare outcome for Indian citizens. I wish to mention to you about the vast network of the primary healthcare facilities in India, which have been renamed as the Ayushman Arogya Mandir, which are 175,000 in number. And at this primary healthcare facility, we have started population-based screening of all individuals, age 30 and above, for diabetes, for 3 types of common cancer, for hypertension. And just on the 17th of September, Prime Minister launched a very unique initiative focused on women's health, Swasth Nari Sashakt Parivar Abhiyan. Because we believe that the health of a woman is the foundation of a healthy and a strong family. And when families are strong, we can have a stronger India, we can have a self-reliant India, we can build a Viksit Bharat, a developed India by 2047. So, a large number of health camps are being organized under this initiative, and screening for hypertension and diabetes and 3 types of common cancer is also being conducted in these health camps focused on our women. In addition to this, my dear friends, we're already running the national program for the prevention and control of the non-communicable diseases, under which our effort is to strengthen the NCD clinics at the district level and the block level so that we can ensure access to healthcare even to our rural population. You just heard our Honorable Deputy Chief Minister mention about Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. This is lauded as one of the world's largest government-funded health assurance schemes, which entitles 60 crore of Indian citizens to advanced hospitalization, which includes the life-saving cardiac care procedures as well. And not to forget that Government of India's focus on Make in India stents, medical devices and implants, that has also brought down the cost and is today ensuring affordability without compromising with the quality. Ladies and gentlemen, technology is another very important aspect of healthcare delivery in our country today. Our government has also launched the Ayushman Bharat Digital Mission, which is seamlessly connecting the patients, their electronic records are being created, the hospitals and the doctors. Everybody is being connected together because of the digital pathways that we have created, and we are trying to build this huge digital ecosystem in the country. And similarly, a simple initiative like telemedicine today, it is empowering a citizen who lives in a hard-to-reach area, a remote location, to consult a cardiologist who may be sitting in a big hospital in a metro city virtually. So this is how we are making healthcare more and more accessible. And we are also trying, I heard the Deputy Chief Minister lay a lot of emphasis on awareness generation among the common citizens. And this is truly what is needed when it comes to cardiac care. We need to educate people that simple steps and consistent changes in our daily living can make so much of a difference. We can protect ourselves from serious health risks by making those little changes. You're hearing the Prime Minister make an appeal to the nation on combating obesity. So when the Prime Minister speaks to the nation from the ramparts of Red Fort, he gives a clarion call, let's fight obesity. And what do you do for it? Just 10% of reduction in your oil intake, reduction in your salt and sugar in your daily diet. These are very simple steps, saying no to tobacco-related products, saying no to alcohol, but it goes a long way in creating that protective shield around us and preventing us from falling prey to the cardiovascular diseases. So it's important that we generate that kind of awareness, and I'm very proud to say that Ministry of Health and Family Welfare, Government of India is making intensive efforts to educate people and make them more conscious about embracing nutritious, balanced diet, incorporating some form of physical activity, yoga, meditation, sports. Fitness is the mantra. So everything, all forms of encouragement. Prime Minister himself performs yoga, and because of the call given by the Prime Minister, more than 120 countries around the world are today adopting our own traditional yoga. So every possible step is being taken to encourage people to adapt, to adopt a healthy lifestyle, a lifestyle which talks about health promotion. And today's conference, I believe, is very significant in once again raising that awareness. So on this occasion, I appeal to all of you that we must once again renew our collective resolve that we have to fight heart diseases, not just in the hospitals, but we have to start fighting them in the schools, in the colleges, in the workplaces, in the larger community settings. And that's when we are going to make a difference. So I just hope that this 2-day-long conference, it is able to enrich science, it is able to strengthen systems, and it is able to create pathways for making more advancements in cardiac care. With this, I once again convey my heartiest greetings to the organizing committee for inviting me here, hosting it in the city of Kashi, and I wish this 2-day conference a great success. I do hope that the outcomes of the deliberations will go a long way in saving millions of lives, countless lives, not just in India, but even beyond. With this, once again, thank you all for your audience. Jai Hind, Jai Bharat.